Hi everyone, my name's Nikki and my partner is Elizabeth, and we're going to be talking about the Zika virus. The Zika virus is an extremely rare virus transmitted by mosquitoes, which causes asymptomatic/mild symptoms. It is related to other pathogenic vector-borne viruses, including those from the West Nile and Japanese viruses, but produces a comparatively mild disease in humans. The first documented transmissions outside of Africa and Asia was in 2007, where the virus caused several outbreaks in the Pacific, and since 2015, it further spread to America. The Zika virus was first isolated in 1947 from a monkey in the Zika forest, Uganda, then in mosquitoes in the same forest in 1948, and lastly transmitted to humans in Nigeria in 1952. Other than mosquitoes, sexual transmission has also been documented in several instances, one being a case from a symptomatic male to a woman as late as 5 to 6 weeks after onset of the man's symptoms. There is also potential risk of Zika virus transmission through blood transfusion and organ transplantation.
Pregnant women are most at risk when catching the Zika virus because of its resulting contact with the fetus through the placenta. Outbreaks of the virus are currently found in tropical Africa, the Pacific Islands, and Southeast Asia, tropical areas facilitating greater mosquito populations. Those most prone to catching the virus fall within the age range of 15 to 29. Methods of avoiding the Zika virus include preventing mosquito bites by using bug repellent and wearing long-sleeved shirts and pants. Practicing safe sex can also decrease the chances of getting the virus by sexual transmission. It is recommended as well to avoid any type of blood transfusion to prevent possible infection. Lower-income communities are working to control the Zika virus by improving waste management and public sanitation in order to destroy mosquito breeding sites.
For the average person, the Zika virus disease is generally mild and hospitalization and deaths are uncommon. But what's important to note is that the virus can be passed from a pregnant woman to her fetus and can cause a birth defect called microcephaly, where a baby's head is much smaller than expected. The virus is also linked to Guillain-Barré syndrome, which is a rare autoimmune disorder in which a person's own immune system damages the nerves, causing muscle weakness and sometimes paralysis. And the virus has also been linked to other serious problems in babies, such as eye problems, hearing loss, seizures, and other fatal brain defects. Although there is a possibility a woman's child won't have birth defects if they carry the disease, and the CDC does not know the full range of birth defects the virus causes during pregnancy. Among women with confirmed or possible Zika virus infection during pregnancy, Zika-associated birth defects occurred in about 5% of babies born to women in the United States and Territories. In the United States and Territories, there are high risks of birth defects during the first trimester, which is 8% of pregnant women with the confirmed virus infection. And in 2016, there was a spike in cases in the U.S., 4,994 being travel-associated and 36,367 being locally acquired. Unfortunately, there is no vaccine for this virus, and if you have a mild case, all you can really do is treat the symptoms and drink plenty of water and get enough sleep, but there is no cure for pregnant women.
The level of precipitation correlates with the population density of the vector or mosquito by providing breeding habitats. Temperature of the vector's environment impacts its development and its resulting transmittance of the virus. Earth's rising temperature will likely increase the rate of possible transmittance by creating an environment more prone to breed mosquitoes. The density of human population per area of transmittance also significantly impacts the rate of exposure to infected vectors. The rising human population can only increase the possibility of exposure to the Zika virus unless more work is done to help low-income tropical communities develop a vaccine.
And here's our works cited page.